Hi, good evening. My name is Michelle Ayabina, and I'm presenting my capstone project proposal. The introduction comprises of the topic and the purpose. The topic is assessing the impact of a national-based electronic health record system in the healthcare delivery to minimize claim denials. It will comprise of the background review, the needs assessment, the stakeholders, the goals, the requirements and tools, and the literature review. The background review is the basis of the project selection and to define the setting and the contact personnel. The needs assessment will perceive the need for the project. The stakeholders will consist of identifying who is at stake and the project accomplishment. The goals will basically cover what the project is trying to accomplish, and the requirements and tools are the resources needed to accomplish those goals. And finally, the literature review comprises of the literature that was used during this process. The background review, it's going to define the EHR versus EMR, the federal mandated enforcement in 2014, the COVID-19 pandemic impact on hospital systems, the setting, and the governing body. Electronic medical record versus EHR. It's a term that's interchangeable. Electronic records, electronic medical records, and EHR are terms that are interchangeable in facilitating the electronic compilation of one's medical records. The difference between them is the middle letter, H versus M. H stands for health, and M is specifically the medical records. The EHR is a useful tool to enable rapid deployment of standardized processes. Electronic health records was federally mandated and enforced in 2014. The COVID-19 pandemic impact on hospitals stretched our healthcare system to its limit in the terms of patient care delivery, efficiency, and quality management. It also took its toll on the financial health of most hospital systems through initial claim denials and decreased revenue for elective services. The setting for this project would probably take place in a maximum security setting, a setting that includes both security for cyber sites and for the geographical location. The governing body should be the government. Let's discuss the need assessments. The need assessments are the care management, the reimbursement for the industry, the record accessibility, and the provider collaboration. Patient care management is the database centralization to assist in patient care and the continuum of that patient care for emergency services, recent labs, and also diagnostic reports to avoid duplication of services for a high-risk patient. The reimbursement aspect is through a centralized system where we can decrease claims denial and increase reimbursement. It will also help to control rates and duplication of services. Example, it will avoid readmissions within less than 24 hours for the same diagnosis within an acute care hospital. The record accessibility, this is the main purpose of this project. It will create a centralized system that we can decrease the claims denial through a non-adherence in the CMS 30-day readmission rates, and also to assist in the opioid crisis by decreasing state hopping for patients between different states. And finally, the provider collaboration. It will provide all the providers, whether it's a doctor, a diagnostic center, a hospital, with immediate access to information, which in turn will address the primary beneficiary, who is our patient. Who are our stakeholders? Our stakeholders are the provider, the patient, and the insurance company. The provider's interest for the sole point and ease of access to improve patient care. The patient's interest as a stakeholder would be for safety and fear of compromise. And the insurance company's interest will be for the contract module and negotiation tool solely for reimbursement purposes. Or stakeholders, there are three categories: the provider, the patient, and the insurance companies. The main purpose of the provider, he would be in total support of this project, again for collaboration. The patient will probably be the negative and the one that will impact and have resistance. The insurance company can be swayed either way, but necessarily needs to be informed. What are the goals for the project? To reduce the number of denied medical claims, improve reimbursement for services, to allow for easier access of patient records to improve care quality, to reduce duplication of services, improve access to patient history and medical personnel, to improve collaboration between the medical providers, the specialties, the pharmacy, and to really share information in real time. And finally, it will also allow for public health needs and assessment. When the healthcare goals are aligned, the system enables the clinicians to achieve their professional goals, and their system usage behavior contributes to improvements of the health outcomes. What goals will this project accomplish? It will reduce the medical claim denials and increase the speed of payment. The ease of access to patients' records. It would also reduce in duplication of services and consolidate the subspecialties under one singular module. In achieving the goal of reduction in medical claim denial within a centralized system, the system can flag incoming admissions that are non-compliant for that specific time period. This will in turn satisfy your goals for improved reimbursement, as the number of denied claims will decrease for a specific denial threat. The specific resolution for ease and access of patient records will collaborate lab results, clinical notes, medication administration, reports, and other pertinent records for the provider at hand. The requirements and tools. The requirements that we will use is to conduct a current tool assessment, the tools of reviewing denial management system for data comparison. We'll also utilize the tools of the Lean Six Sigma principles and, of course, search for evidence. In conducting a current tool assessment, we will find out what is effectively working on the market today by conducting a survey of provider preferences. In reviewing the denial management system for data comparison, we will also look at data management reports. Utilizing the Lean Six Sigma principle, we'll implement the DMAIC principle in order to define the current problem, measure it, analyze the opportunities and weakness, and improve current systems and implement controls to meet the required goals. And finally, we will search for evidence by utilizing the root cause analysis and using the confidence interval, which is a part of the Lean Six Sigma principle. Let's discuss the literature review. The keywords in database used in this literature search, keywords utilized were electronic health records, medical records, claim management, denial management, data security, privacy, electronic records, electronic medical record system, medical database, etc. There were quite a few, but these were the ones that we limited it to for the purpose of this PowerPoint. The databases utilized were EBSCO, the Fowler Library through CCU, and Google Search. Inclusion and exclusion criteria. The sources included were those that were relevant to time, purpose, and displayed authority of the subject. The grading the quality of the research. In order to grade the quality of the resources that were used, we utilized the CRAP scale. As you can see, the articles are listed to the left, and the currency relevance, authority, accuracy, and purpose was the scale that was determined to determine the validity of each resource that was used. All resources were current within a 5-year period. As you can see, Article 1 was dated 2016, Article 2 was 2020, Article 3 was 2016, Article 4 was written in the year of 2017, and Article 5 being our most recent in 2020. In utilizing the CRAP model scale, I was able to evaluate the sources utilized in the project and its usefulness. The following criteria again were measured: the currency, the relevance, the authority, the accuracy, and purpose. What is the currency, you ask? It is the timeliness of the information. How current is the information that we utilize? The relevance displayed the importance of the information for the needs of the project. The authority was the source of the information, and the purpose, the accuracy. The accuracy was the liability, the truthfulness, the correctness of the actual content within that article. And the final purpose was the reason that the information existed. Article 1, that citation was by J. Arthur, and this article justified the usage of the Applied Six Sigma Lean Six principles. In this article, he described the confidence interval as representing the range of values that included the true value of the population parameter being measured. Article 2 citation was by Fakharizi and et al., and this addressed the need for more concerted measures that should be implemented to ensure that future digital health initiatives will have a greater impact specifically on the epidemic. Article 3 specifically addressed the aspect of goals. When the healthier goals are aligned, the system actually enables the clinicians to achieve their professional goals and their system usage behaviors, which converges and contributes to the improvement in health outcomes. Article 4 described the importance of having the provider sphere of influence, which will captivate the clinicians, the administrators, and the patients. The doctors and nurses perceive that the quality of the patient data is better when the EMRs are easier to use and better aligned with their daily routine. The fifth article by Reeves demonstrated that the EHR was a useful tool to enable rapid deployment of standardized processes. The biblical perspective was ascertained through this project is a need for acquiring understanding. The Bible directs us that in the beginning of all things, get wisdom. Get wisdom, and whatever, get insight. And whatever you get insight, according to Proverbs 4:7. As mankind strive for higher heights, the foundation of every project should be sturdy. While the technology and tools of defining, measuring, analyzing, improving, and controlling are readily available, the ultimate tool is the application of wisdom, and it is profitable to direct. The biblical perspective, coupled with knowledge, rewards gains that are better than silver and profits that are better than gold. The Bible reminds us that blessed is the one who finds wisdom and the one who gets in understanding. For the gain for her is better than gain from silver, and her profit is better than gold. In conclusion, in presenting this project proposal for an assessment of the impact of a national-based EHR system in healthcare delivery to minimize claim denials, we can support these requirements. The background view, which defined the usefulness and impact of the national EHR system. The needs assessment identified the top needs and assess its current and futuristic effect. The stakeholders were able to identify the stakeholders and each of their positions within the project. The goal conducted an alignment and determined avenues of meeting. The requirements and tools were determined for measurement and improvement, and the literature review justified the resources used by testing through the CRAP scale. The future of healthcare is bright, yet it is still complex. By introducing a national EHR system, we can reduce claim denial, expand patient care continuum, assess public health measures, and unite our healthcare system